I didn't realize that it was depression until I was an adult. You can't see the sun, you can't see the sky, everything's gray.
Within myself, I felt like the world was closing in on me. That's one of the worst feelings that anyone can experience. But it felt like my inside had just left wandering somewhere else.
I was afraid to seek help because I didn't want anybody to know that there was something wrong with me. I definitely had in my mind, the stigma of depression as being a mental illness that could keep me from working. I didn't want anybody to find out about it. I was afraid if they did, I would lose my job.
The mission of the Brain Health Center is to develop, implement, and test new models of integrated care and to test groundbreaking research. The Fuqua Center is involved in both of these efforts. The first end, we're trying to develop and implement new models of care in the community as well as in the center, and all of our models of care are integrated. That is, we combine both neurology, psychiatry, as well as internal medicine, and providing a continuum of care for the older patient with multiple medical problems, as well as depression, anxiety, and psychosis. Our research ideas stem from the fact that elderly patients typically are some of the most treatment-resistant patients.
My father was interested in forming a center for late life depression because he suffered from depression most of his life. And as he got older, he became very aware of the needs of many of his peers to be treated. And the treatment options were limited, particularly for those who were less fortunate. It's hard for older people and their families to address depression because oftentimes what seems to be stereotypical behaviors of older people, many are really symptoms of depression. There's a misunderstanding about what the symptoms are, and it's not part of normal aging. Well, it's been extraordinary. It really has been extraordinary. The number of people that are touched by the services and the treatment that's available, the community outreach, those things have made a tremendous difference in thousands and thousands of lives of individuals and their families in the state.
The Fuqua Center has helped us as a state agency bridge the gap between aging services and behavioral health services. They have almost single-handedly taken the lead in addressing the gaps that are there, both from the aging side and the behavioral health side, and working across agency lines and building that bridge for us to make sure that the public has access to the services that they need. The Fuqua Center is pretty much the leader in providing services to older adults with mental health, not only in providing the direct service, but also in helping develop a system that can address the larger need across the state of Georgia.
As the Area Agency on Aging, the Atlanta Regional Commission provides direct services and plans for the future of older people and those who care for them in the 10-county metropolitan area. And over many years, we've had the great pleasure of partnering with the Fuqua Center.
The Area Agency on Aging expands our reach into the community, allows us to reach the most vulnerable older adults in the community. And through aging services, it also helps us to expand the workforce. With our partnership, we're able to access the most vulnerable older adults and practically implement evidence-based practices. We're in it for the long haul. Together, the Fuqua Center and the Atlanta Housing Authority are creating communities where residents can provide assistance to their neighbors because they have been trained in mental health first aid. We have brought the array of both public and private services which are necessary to take care of older adults adequately, and creating that collaborative network of behavioral and social services providers. In collaboration with Leading Age, whose membership are affordable housing and services for older adults, and in collaboration with the University of Washington, we have been able to impact the skill set of persons in affordable housing, teaching them how to screen, and teaching them how to provide basic behavioral health interventions as well.
The Fuqua Center takes a much broader, comprehensive approach to the health and wellness of older people in the community, and that has challenged us to think more systematically about fundamental issues of housing and transportation options so that our region really can be a place for people of all ages and all abilities to live.
At the Carter Center Mental Health Program, our main mission is to reduce stigma and discrimination against people with mental illness and to increase access to quality mental health services for all Americans. Our health system is complicated. Many older adults are going to have a number of chronic conditions, and it's important that they be involved in care systems that understand that, appreciate it, and ask all the right questions.
Coming here and finding the people who were able to direct me in different directions, provide me with the accurate kind of medication and the support that goes with that, really did save my life.
I thought that I would never pull out of the state of depression. I never thought that I would.
Everything that I've gone through, I would not trade it for anything, because material things you can get day in and day out, but you only get one mom. So it's well worth it, and it's worth hanging in there.